Hi, I'm Dr. Lorenzo Cervantes. If you're watching this, it's probably because you've been told you have dry eye, or you're experiencing symptoms that might be related to it. This is one of the most common things I see in my practice, but is also one of the most misunderstood. Many people associate it with allergies or pink eye, or think it's just a little dryness, but dry eye is usually not just about dryness. It's a complex condition involving inflammation, lifestyle habits, and long-term maintenance. Let me walk you through what dry eye actually is, what causes it, and what you can do about it, so you can start taking care of your eyes before symptoms get worse. Have you ever felt like something's in your eye, like a grain of sand or an eyelash? Or noticed that your vision gets blurry when reading or looking at your phone? Or had red, irritated, or itchy eyes at the end of the day? Or had styes or swollen eyelids? These are all possible signs of dry eye. But here's the thing, dry eye isn't always about your eyes being dry. In fact, for many people, the eye may feel wet, but still be inflamed and irritated. When I hear dry eye, I think of inflammation. Inflammation of the ocular surface, which includes your eyelids, tear film, conjunctiva, and cornea. That inflammation builds over time, and if left untreated, it can lead to long-term damage. Let's break this down. The ocular surface includes tear film, the wet layer that keeps the eye smooth and moist. Eyelids, they help spread your tears and also contain the eyelashes that catch dust and debris before it reaches the eye, and glands that make the oil and water layers of the tear film. The conjunctiva, which is the skin of the white of the eye, and the cornea, which is the clear front window into the eye. All of these parts work together to keep your eye surface clear, hydrated, and protected. If any one of them is disrupted, it can throw the whole system off, and that's when the dry eye starts. When your tear film evaporates too quickly, or you don't blink enough, or your oil glands get clogged, your ocular surface becomes rough and irregular, and light no longer focuses clearly. The result? Blurry vision, discomfort, redness, fluctuating vision, irritation. Imagine a smooth, wet crystal ball. It's perfectly clear, but if it starts to dry out or it gets dirty, it gets cloudy and rough. The same thing can happen to your eye. Why is dry eye so common today? A big reason is blinking, or the lack of it. We're supposed to blink every 3 to 4 seconds to keep the eye moist. But when we're driving, reading, watching TV, or looking at our phones, our brain tells us to stay focused, and we stop blinking. You might only blink 3 or 4 times a minute, and in that time, the tear film evaporates and the surface dries out. You have about 20 to 30 meibomian glands in each eyelid. They produce oils that keep your tears from evaporating too fast, but these glands can get clogged from inflammation, poor hygiene, or just buildup over time. When they get blocked, the oil gets trapped, swelling builds, more neighboring glands get blocked, inflammation spreads. It's a vicious cycle. Left unchecked, it only gets worse. The key to treating dry eye is to stop being reactive and start being proactive. Dry eye creates inflammation, and inflammation feeds on itself. If you only use drops after your eyes feel dry, you're reacting too late. The better strategy is daily maintenance to prevent symptoms from flaring up. Here are 4 essential daily habits that everyone, and especially surgery patients, should do. First, lid hygiene. Clean your lids and lashes twice a day with a gentle cleanser or lid wipe. Don't use washcloths or tissues, they're too abrasive. You can use lathered fingertips or a lid wipe with an active ingredient to remove bacteria, Demodex, and debris. Second, warm compresses. Apply gentle heat to your eyelids to melt thick, clogged oil glands. Like melting butter, you only need to raise the temperature a few degrees. Use a warm compress mask, rice sock, or electronic device. Do this daily to keep the oil flowing. Third, mindful blinking. Be aware of how often you blink, especially during screen time or long stretches of concentration. Take breaks every 20 minutes to blink intentionally. If you can, close your eyes for a few seconds to let the tear film reset. Fourth, preventive lubrication. Use lubrication drops before your eyes feel dry, not after. Before you drive, before you read, scrolling through your phone, or working on a screen, put in a drop. This delays dryness and protects the surface. If daily maintenance doesn't keep your symptoms under control, we may need to use a prescription medication or rescue therapy like steroid drops to calm the inflammation first so that your daily routines can work more effectively. Dry eye is something we always look out for, but it becomes especially important if we're planning any type of eye surgery, including LASIK and cataract surgery. No matter the procedure, dry eye will always get worse afterwards, at least temporarily. And if left unaddressed, it can affect how well you heal, how accurate your preoperative measurements are, how clear your vision ends up, and how happy you are with the results. Getting ahead of dry eye before surgery is one of the best ways to improve your outcomes. Dry eye is really common, but it's not simple. Everyone experiences it differently. Everyone has different risk factors, routines, and stressors. There's no one-size-fits-all fix. The goal of this video was to help you understand what the ocular surface is, what happens when it's not working properly, what you can do every day to maintain it, and how to keep your eyes comfortable, whether or not surgery is in the picture. I hope this has been helpful in giving you the understanding and tools to start taking care of your eyes. We'll talk more about your specific case when we meet. Thanks for watching. I look forward to seeing you soon.